of a scar will you get after your forehead feminization surgery? Hi everyone, I am Dr. Sanchaita Kohli, a maxillofacial surgeon from New Delhi, specializing in facial feminization surgeries. And today we are going to talk about the different kinds of scars and approaches after a forehead feminization surgery. Forehead feminization surgery is a broad term that can be used to describe a set of procedures that are performed to make the forehead look more feminine. This can include procedures like forehead bony reconstruction, orbital contouring, a brow lift or a forehead lift, a hair transplantation, or a forehead reduction by hairline lowering. Not every patient needs all of these procedures. So the kind of incision and approach to be taken for your forehead feminization surgery depends on the type and number of procedures which have been recommended for you by your surgeon. Let's make this simpler. There are two main types of approaches which can be taken for your forehead surgery. The first one is the coronal incision. The coronal incision is taken within the hair-bearing part of the scalp, a few centimeters behind your hairline, extending from one ear to the other. This incision is completely concealed and hidden within your hair. The coronal approach is commonly used when the forehead feminization requires predominantly bony contouring work. So the scar that you can expect after a coronal approach is well concealed within your hair. The second approach that can be taken for forehead surgery is the hairline approach. The hairline incision is given at the junction of the forehead skin and the hair-bearing part of the scalp. This approach is taken whenever there is a need for reduction in the height of the forehead by means of hairline lowering or scalp advancement. So if your surgeon has recommended a forehead reduction or a hairline lowering as part of your forehead feminization surgery, you can expect a scar at the level of the hairline between your forehead skin and the scalp. There are specialized surgical techniques that can be used to make hairline scars well concealed and aesthetic. If designed and closed by an expert surgeon, the hairline scars heal beautifully and are imperceptible after a few weeks of the surgery. So if you need to know which of these two approaches will be used for your forehead feminization surgery, you need to consult an FFS expert to guide you properly. Thank you for listening to this video.